We're living longer lives, but with more years in poor health than at any point in history. How can we change this? And what are the pharma industry's responsibilities and opportunities? These questions and many more will we, MSD, try to answer together with people of different perspectives by creating a space for dialogue. We hope to promote diversity of opinions and provide food for thoughts. We call it Voices of Pharma.
Welcome to Voices of Pharma with MSD. I'm Catherine Williams. I'm the Managing Director for MSD for Denmark and Iceland. And we're going to be having a conversation today about a topic that is close to my heart, and that's diversity. And in particular, we're going to be focusing on health equity in society. For that conversation, I'm delighted to be joined by two very special guests in Peter and Phaedria. Would you like to start by introducing yourselves? Peter, maybe starting with you.
Absolutely. First of all, thank you so much for the invitation. So my name is Peter Drøidal. I'm the country manager for a pharmaceutical company, Novartis. So we're one of the biggest providers of medicines to patients in Denmark. So I've been working within healthcare and the pharma industry for almost 20 years. Super interested in healthcare and how we can actually make health, you can say, a key topic for politicians. I'm also very engaged in our trade associations. So I'm the chairman of our industry pharma association named called LIF.
Great, thank you, Peter, and welcome.
Thank you.
And thank you for the invitation, Catherine. I'm Phaedria Marie St.Hilaire, and I'm a life science business leader with 25 years experience in biotech and pharma. And I'm also a fierce advocate of diversity and inclusion. And those two come together in my consulting business within pharma and as co-founder and president of Professional Women of Color in Denmark.
Fantastic. So a wealth of experience we have in the two of you, and I'm really looking forward to seeing where the conversation goes today. Okay, so maybe starting with first question, what does diversity mean to each of you? And Phaedria, you mentioned that in your introduction there, that it comes together with your life science experience and background and very much part of what you're doing now. So maybe you can just share with us, why are you passionate about diversity? What does it mean for you?
Oh, that's a tough question. It stems, when I reflect on it, it stems from my childhood and growing up with a mother who was a huge proponent of gender equality. And then growing up in a country where everybody looked like me, the main focus was mainly on gender diversity, this component. But when I moved to the US to study and being one of the few women in STEM, I became more aware that there are many different dimensions of diversity. And it's I'm driven by a sense of fairness and equality. And so for me, it's very important that all the different dimensions of diversity that we see in our population, it's represented in everything that we do, in the policy making, in the health industry, in the, all over. Because I think when you have a diverse perspective, diverse people, and your diverse perspectives, they come out of your lived experience. When you have that, then it just makes everything better. The world would be a better place.
And isn't that a wonderful vision to aim for, that the world is a better place, and we play a big part in influencing that?
Yeah, absolutely.
And interesting there, you mentioned that it comes from your value of fairness. When I reflect on it for myself, it's very much about my values that drive me, and again, it's fairness and equity. Peter, I don't know for you if there's something different that perhaps drives you, or is it very similar?
No, it is actually very similar. So the fairness piece is also, you can say, a fundamental piece of Danish society. And of course, working within healthcare, that should be the basic for how we provide healthcare.
When we talk about diversity in our organisations in industry, we're talking about the composition of our workforce. And of course that's important, but our job does not stop there as industry partners and those of us that work in life science. It is very much about ensuring that we are a key collaborator in driving an equitable health system. Perhaps, Phaedria, can I come to you in terms of how do those two things, diversity and the health system, come together for you, and what more could we be doing?
I think if we take the starting point that there is not health equity, there is a definite health inequality, and that has been made worse, especially after COVID, and also through climate change. And I think that's founded in the growing gap in our socio-economic status. And there are different dimensions to it. If you think just three of them, the first one, as a healthcare company, when you make the decision to develop certain drugs, who do you develop them for? What's the driving force? Why do you want to do it? Is it because you want to develop a drug that will impact the majority of people, or because you want to develop a blockbuster? And very often we see, for example, for infectious diseases, there's not a lot of new drugs being developed in that area, when we know that a majority of people are affected by infectious diseases, because it's very rare that you would get a blockbuster out of that. So it has to do with when you make the decisions as to which drug you should develop, are you making the decision so it can impact the diversity of people? Then the second aspect has to do with the, I think we're going to talk more about it, but the clinical trials. Again, we know that there are differences in the how people with different genetic makeup will respond to different drugs. And so when the trials are designed, I think as a pharmaceutical company, it's very important that you ensure that your eligibility criteria, that they include as diverse people as possible. And then the third aspect, which would be for more of a collaboration, has to do with the healthcare providers. How are they trained? We know that, particularly in the US and in other countries, that the level of care that certain populations receive, it's not the same as the level of care you would have in the predominant population. So for me, having a diversity mindset and an inclusion mindset is very key in all the different aspects to eliminate health inequities.
So we've touched a little bit on gaps in the health system. Perhaps we can expand a little bit more on concretely, what do you see as being the key problems that exist in the health system, or key gaps that drive the inequality we see? Peter, perhaps starting with you.
Absolutely. So probably different elements, right? But one key factor would be I would say, lack of focus on prevention in the healthcare system and society overall. So we know that if you're getting, you can say, a late diagnosis, then you also know that treatment will be more difficult, and overall survival in the end will also be probably impacted. And we know that is having a big impact on individuals with you can say, lower socioeconomic status. So that's key. But also the complexity of the system in itself. Being a patient, it can be difficult to navigate in the healthcare system. And just communicating with the healthcare professionals. And if you have a high education, you actually do that better. And it is causing challenges if you are, you can say, on the lower end of your socioeconomic position. And also that Bermuda Triangle between, you can say, GPs, hospitals and municipalities, navigating in that can be difficult for patients. And we know it is actually creating inequalities. So I think there's a lot of things we can do better also in Denmark.
So reflecting on our own organisations and the pharmaceutical industry, do you believe we are diverse enough ourselves?
That's a good question right now. No, I don't think that we are. You can say, if you look at our industry, we are not representative of the population, the Nordic population overall. I don't think we are. So just looking at the educational level in our industry, that's actually very high. It's just an entry ticket to get into the industry, right? But I don't think that we overall, when you look at education, income, gender, age, ethnicity, I think it's absolutely improving. It's on the agenda, but we are not fully diverse, you can say, matching the population. I don't think so.
Yeah, I think really like the point, Peter, about education. And we had an initiative in our US organisation, actually, with MSD, where we recognised that a prerequisite on our job descriptions was to have a degree, for example, the equivalent of a degree. And so this initiative was about ensuring that we were recruiting people from lower socioeconomic backgrounds who didn't have high qualifications. And that I thought was a really interesting way of ensuring that we're challenging our own biases, because we all have them and that's fine, but we need to recognise them. So I was reading recently about the consequences of health inequalities, and a report that I read from the European Parliament estimated that losses linked to health inequalities cost around 1.4% of GDP, which is pretty much equivalent to the EU's defence spending. So I guess the point being, health inequalities cost the EU quite significantly. Bringing it back to Nordics perspective, we've talked about the gaps. We've talked a lot about what we can do to address some of those gaps. What do you consider as being the consequences of not getting diversity right and doing enough?
I foresee a vicious circle it's just going to get worse and worse and be exacerbated. So we need to have diversity in the policy makers, whether it's in the pharmaceutical industry, in the government, so that we can implement solutions that will benefit everybody and break the vicious circle.
Great.
Yeah,
Thank you.
I fully align with you. Maybe we also talked about clinical trials, right? And if we do not get it right with the clinical trials, or the diversity, you can say, in the clinical trials, and also on the, you can say, the patient population, then we probably will lose, you can say, the opportunities we have to do clinical research in our countries. Then it will just go to countries where they're better in diversity, right?
Yeah, absolutely. And the Nordics is a world leader in clinical research. That's why often our organisations come to the Nordics, because of the rich data we have. So we need to nurture that and protect it.
Exactly.
And ultimately, it's about the good of the patient. So all the topics we've covered in terms of access and affordability, if we haven't got the data to help us create that access, it's going to be a real challenge for us. So lots to be done. It's going to keep us very busy. And I guess this is also where diversity comes back in, because as organisations that we work in, we have diverse experience, diverse perspectives. And for me, that partnership and collaboration is all about bringing that to the table, irrespective of the company or the organisation we work for. Everybody has something to offer. And we have the same goal, ultimately, which is for the good of the patients, whether that's preventative or curative. We all want the same thing. So coming around the table together, defining that common goal, I think is something that we could continue to do more regularly, more often, perhaps more openly and transparently sometimes, to make sure we are solving the right problems. And some, of course, are easier to solve than others, that's for sure. Thank you both so much for sharing your perspectives today. It's been really enjoyable to have a really rich conversation with you both, and I hope you've also enjoyed it as well.
It's been a pleasure being here, sure.
Great.
Yeah, it's been a pleasure and lots of work to do.
Certainly lots of work to do.
That's for sure.
A good note to end. So my name's Catherine. Thank you so much for watching Voices of Pharma.